Section 1 provides context and gives you a picture of the amount of collaboration and merger activity currently underway. We also present the key principles that are the foundations of this course. Unless you work in the area of collaborations every day, we strongly recommend you view this section. And if you're planning to discuss these materials as a group, such as a board or executive team, then this section is a must. My colleague, Professor David Gilchrist, will begin by outlining what is happening in the sector.
We've been researching not-for-profit collaborations and mergers for a number of years now. We've interviewed thousands of CEOs and directors, and we've found the results to be consistent. Firstly, despite the commentary in the sector, the extent to which NFPs collaborate already is enormous. This is data from a survey of over 2,000 directors of not-for-profits conducted in 2015. As you can see, 70% of directors report that their organisations collaborate for advocacy. This includes joining industry peak bodies like National Disability Services, joining with other smaller groups of organisations to advocate for a particular outcome, such as industry reforms, and in some cases working with other NFPs to collaborate for an individual. For example, 2 or more organisations supporting a teenager who is homeless and ill and needs support from a government agency. Over 40% of directors also reported that their organisations subcontract the provision of services to other NFP organisations. This includes, for example, arranging for another organisation to deliver your services in a location, such as a remote community. It also includes such things as directly contracting organisations that provide specialist aids and equipment to fit out accommodation. We have seen a big increase in agreements and MOUs to refer or service clients since the introduction of person-centred funding. In the past, individuals were not able to choose their provider of services. Now, organisations compete for clients and will establish MOUs to cross-refer clients where they cannot meet their needs, effectively creating a marketing network. An example of this would be a specialist provider of support for people who are vision impaired, referring any clients with physical disabilities to the partner organisation and vice versa. About a quarter of directors said their organisations are sharing resources. This is often one of the main areas NFPs are told to collaborate more in. The idea is that if one organisation has an office or staff in a location, that instead of another organisation replicating these administrative resources, that the 2 organisations share. Finally, 15% of directors report that their NFP outsources back office functions. We think this number may be somewhat understated, particularly for the larger organisations in which the directors may not be aware what services are actually outsourced. When we ask this question of CEOs, the numbers are actually higher. Either way, the data shows that collaborations are a key way in which NFPs deliver their mission. There are a couple of other interesting findings from the research. Having asked about their existing collaborations, the following year we asked directors about their organisation's intentions to increase collaborative arrangements. The results show that most directors expect their organisations to do more of what they are already doing. That is, 70% expect to increase their collaborations for advocacy. More than half expect to increase the number of MOUs they have for service delivery, reflecting my comments earlier in relation to the earlier slide that this is a growing area as a result of the impact of person-centred funding. You can see that a third of directors also expect to increase resource sharing and subcontracting. What these results are telling us is that the boards and CEOs are actively seeking to build collaborative networks, which is one of the reasons for providing this course.